Today I'm going to do a video on what is in my nursing lab kit for school. Hope y'all like it. Okay. So, this is Zoe. She's like, what the heck is going on? Yeah. This is Zoe. Okay, so anyway, I'm back now. Now, this is a video on what's in my nursing bag for lab during nursing school. So here's the bag. It's just red. And it has the Holmes logo on it. Touch y'all down some. So here's the bag. Y'all aren't going to be able to see me, but here's the bag. It has a little place for your name, a little name tag, but it has my info in there. And then there's the handle that you can carry it by. It also has a shoulder strap on it, so you can carry it over your shoulder. Cat's trying to play with the bag. And then it has two side pockets. There's a pocket over here and a pocket over here. And then in this pocket right here, there is, some of the stuff is open. Well, most of this stuff is open because I had to use it for checkoffs. The first thing I have is called a tracheostomy clean and care kit. I don't know if y'all can see this. May have to. Tracheostomy clean and care kit. And then in it, it's just the different things you need for a trach cleaning, gloves, cleaning stuff. And then I also have a gown, a yellow gown like what you see at the hospital. Like when people go into labor and delivery rooms. And there's my cat again. This is kind of hard to see through the bag, but it's like an IV bag. If you were to hang medicine for somebody and that's being administered through an IV, that's what this is. It's a bag of medicine. Would you stop? Okay, that's all for that pocket. And then in this pocket is, it's like saline solution. It's probably just water. And then here's what we call our skin. It's a pad that you can use to practice using needles to practice giving shots. So you can like push it up for putting the needle in, and you can actually inject medicine and stuff into here. It's really cool. There's that. And that is all that is in that side pocket. Then for the big pocket. So in this big pocket right here, we have a lot of stuff. It's not organized. It was all organized when I first got it. But since then, it's kind of, I just kind of throwing stuff in here. So first thing is suction kit. or a catheter section kit. So it's pretty much what we use for our trach checkups when you're going to go in and suction a trach out to make sure it's clean. And then you clean the trach and all that stuff. It has gloves, kind of show you. It has a box to put saline in, gloves, and then there's a tube back here. Tube back there for the actual suctioning. This, there we go. There's tape in here that's sticking stuff together. But this, it goes back in that bag. I just kind of hadn't put it back in there yet after my check off today. It's a tube that you put down their nose for feeding. So that's what this is. And then there's the part right here. I'll show you what that's for in a second. So there's this kit, which there's this kit which has the syringe in it, and then that's what this part is for. You go in and take, hold on, it's a little difficult, but there you go. You take that off, and then you would take the syringe, draw up your air, and you put it in the top, and then you push down, oh, hold on. You push down on the top of the syringe, and then air goes through the tube. Or, that's for checking for placement. If you're feeding them, you would take it out, and then you pour the food down in the syringe. Okay. May I help you? She apparently wants to join. Okay, so there's that. I need to fix all this later. Okay, so then over here, there's this bag. We'll get to it later. Then we also have, we use these at the beginning of the semester. They're just gauze sponges for when we did wound care. And then we have some gloves in here. Some gloves. Because you're going to be using gloves for a lot of things in nursing school. Whether it's clean technique or sterile technique, you'll pretty much be using gloves. No matter what. And then we'll get to our big thing, which is our Foley catheter kit. And yes, you learn how to put a catheter in somebody. If you don't know what a catheter is, it's something that goes up into the person to let them be able to use the bathroom without them doing it themselves, if that makes sense. Trying to keep it PG still. It's just a tube that goes up in there. So you got your tip. And then you have gloves. These I put in there. They're not the ones that come in it. And then you got your cloth to put down, because this opens up on the bed. And then you put this down to form a bridge up underneath them, so it's sterile. And then you have this, which has all your supplies, such as your lube and your lubricant and your saline solution to check the end of your catheter to make sure the bulb works. And got your iodine to wet your cotton balls. So that's one thing you have to make sure your patient isn't allergic to iodine or shellfish before you start a catheter, because if they are, then you're going to have to find some other substitute besides iodine to use to clean them. And there's the catheter, and then this is the bag that the urine is collected in. Fun, yeah. There's that. Try and kind of put that back together. Not even. We'll fix this later. Okay, and last but not least is, we'll move this out of the way, the big bag of stuff. So in here, we have a mask. Probably not going to take all of this out because there's multiples of a lot of stuff. What is this? A catheter extension set, I believe. This looks like a extension to an IV. If you want to piggyback another medicine, I'm not positive on that, but that's what it looks like. I've got some pads for wound care, for covering up wounds. We have some more pads. These are more of a dressing, transparent dressing than a pad. Some more of those. We got some sponges. We have more gauze, or what? Yeah, gauze bandage. We have a bunch of, what are these called? Vacutainers. I can think of the name. Vacutainers for when you draw blood. A lot of times if you're, well, most of the time if you're drawing more than one vial of blood, it'll go in. You use these to collect your blood. It'll hook up to the end. Let me see if I can find it. The syringe. I can't find it right now, but when I get there, I will show you all what those vacutainers hook up to. There we go. Well, there's part of it. So you'll have this little needle. There's a needle in the center. That is just what hooks up into the plastic thing, if I can find it. Ha! There we go. So this little thing hooks up into here. You screw it on like so. And you don't want to do that because the needle definitely just came out. Put that back on. But then you put the vacutainer and you put it up in here after you put the needle in the person's arm, obviously. And then you push it on here, and then the blood will come out into the tube. That's just, if you're wondering what that is, it's just fake blood from class. Okay, I'm gonna take this up. So you screw the top off, not pull it off, because that's what happens. The top comes off the needle. Screw the top off. There we go. Oh, I didn't tell you, there's actually a needle in here too. That's how the blood goes into the vial. Sorry, had to deal with the dog. Okay, so, this is what we call a butterfly needle. It's for if you're trying to put like a tiny vein like in the hand or something. You would put one of these in there because it's a smaller size needle. So it's easier to get in the vein. some more pads. This is a really big syringe. Not sure what these are used for yet. It looks like there's some solution in it, so I guess I'll find out what that's for. It says it's a flush syringe, so I wonder if it's like to flush a line. Well, I'll find out what that's for later on the semester. Or the year, I guess, maybe. Because all this stuff is for the whole year of LPN school. It's not just one semester. If we had to buy one of these each semester, I wouldn't be in this class. Because this was not cheap. Another syringe. Yeah, I know this is for hanging this one. This set is for hanging medicine. I'm guessing that's what this is for too. Not quite positive on that. We have an IV start kit. Everything you need to start an IV. Like a tourniquet. And iodine, alcohol pad, gauze, gloves, Band-Aid, I think that's what that is, and some tape. A gazillion alcohol pads. Yeah. A gazillion of these. Because you'll use them for everything. We have a IV catheter. That little thing. My cat's over here playing with my foot. More pads and bandages. There's a lot of the same stuff in here if you haven't noticed. These are more IV catheters. But it's just like the needle part with that black and white thing I showed you, just the needle and the other part that goes into it. Another syringe. I got some bandage scissors. We haven't gotten to use these yet. Here's another smaller medicine bag for hanging. It's teensy tiny. Another syringe. This one is 10 milliliters. 10 milliliters. Alright. I don't know what I was thinking. And then we have some vials of stuff. We have some bacteriostatic water. Bacteriostatic water. Here's some more of those vials of fake blood. We have a vial of insulin, I believe, or no, this is Proctitin. It's not insulin. We do have vials of it, not real insulin, and obviously because we're practicing with it, but we have vials of practice insulin. Well, it is practice insulin, we have vials of insulin. There's that powder. Well, it was powder. It went with the Bracty water, and we mixed them together to form a liquid that looks kind of like urine. I'm not gonna lie, it looks kind of like urine. We got a lot of these. Oops. Teeny tiny little syringes. These are more for insulin if you're diabetic. Some spare needles. Where is it? Oh. Well, there's the one that was already put together. I guess I just broke that last one. Whoops. Well, I didn't like literally break it, but I mean I broke the seal on it. Thought that was one that was already used. Whoops. Alright, here's the insulin. We have a regular insulin. And then we have what we call NPH insulin. So yeah. Those are, I believe, are all our vials. Oh, and there's my cat jumping onto the table. Sorry, guys. So, yeah, everything else in here is pretty much a duplicate of what y'all have already seen. So, yeah. That's a video of my, oh, well, there's the cat behind me. Oh, wait, and I'm going to show y'all. This didn't come in our kit, but we also had to buy it for nursing school. It's my stethoscope. It's a Littmann, Littman. And it wasn't too bad. It was about $80, but it's gonna last me hopefully a while throughout my nursing career. Excuse the noise in the background. That's my cat. But anyway, so here's my stethoscope, and it's a periwinkle, I believe, or no, not periwinkle. It's what is that color? Some form of blue. Oh, seal blue. That's what it is. It's seal blue color, but it comes with the rubber tips. If it would focus on them. Comes with rubber tips, and then it has the diaphragm and the bell. The bell and the diaphragm. And yeah, I really like it. It's worked really well throughout nursing school so far. I'm sure it'll stay that way. But yeah, so there's what's in my lab kit, and we also have to have uniforms for clinicals and nursing books. But I didn't want to get into detail into those in this video, but if y'all want to see what all we have to have for nursing school, let me know in the comments down below. And I'll probably make one of those for y'all. But I will see y'all later. Please comment, like, and subscribe to my channel. Thanks, guys.